First Lady Tammy Murphy is taking a final bow on one of the signature efforts of her tenure, maternal and infant health. At her 8th and final Nurture NJ Leadership Summit, Murphy reflected on years of progress that helped move New Jersey from near the bottom of the nation to the middle of the pack for maternal health outcomes. But as senior correspondent Joanna Gagos reports, the message wasn't about closing the book, but continuing the work, with Governor-elect Mikey Sherrill pledging to carry the mission forward.
This work has been, without question, the most meaningful work of my time as First Lady and my life.
You could call it a victory lap of sorts in a relay race that's far from over. First Lady Tammy Murphy took the stage last week in her 8th and final Nurture NJ Leadership Summit, looking back on all she's accomplished, yet laser focused on the work that continues.
Our responsibility is to make sure that every future administration and every future legislature and every future health system leader sees maternal and infant health not as optional, but as essential. And our hope is that this summit and the movement that all of you have helped to build sets the model for how others across the nation and honestly around the world can strengthen partnerships, center community voices, and join us in creating the safest state in the safest nation to deliver and raise a baby.
In a room of about 800 maternal health advocates, Murphy shared that New Jersey's climbed from the 47th in the nation to 25th for maternal and infant health outcomes in the last several years. And there was a figurative passing of the baton from the Murphy administration to Governor-elect Mikey Sherrill. While introducing her, Murphy asked the crowd,
"Did you know she delivered a baby in the back of a taxi?"
As a mom of 4 kids, and yes, you heard it. One of them I delivered myself. I don't recommend it.
Sherrill reaffirmed that this issue is a key priority when she takes office in January.
Maternal and infant health equity is not a side project. It is core to who we are as a state. As I stand here today, I want everyone to know this. I'm committed to continuing that important work to improve maternal health outcomes, particularly for Black women in the state of New Jersey. We'll work to expand programs that build the midwife and doula workforce and leverage telehealth services, remote monitoring, and home visiting programs to support postpartum outcomes and healthy infants.
One of the key changes in maternal health has been the expansion of Medicaid coverage for midwives and doulas in the birthing space to give voice to patients who've often been ignored. But even with that expansion, some experts say it's not enough.
I know a lot of doulas who are in this space who walk into rooms and do not feel recognized, do not feel safe. And so just as much as it's important to ensure that we create spaces that are safe for our families, we also need to ensure that our care workers feel safe, feel dignified, and feel like they're part of a community. And so our commitment is really restoring the birth village, right? And wherever that's taking place, whether that's in the home, in the hospital, or in a birth center setting.
And they talked about the continued challenge of reaching out to women in communities of color where trust in the healthcare system still needs to be regained after a history of Black women being experimented on during slavery, to physicians erroneously being taught that Black women don't feel pain in the same way that white women do.
You are able to build trust with authenticity, with humility, with time, with grace, and with resources. You don't come knocking on anybody's door without something to offer them. Yes. Okay? I'm talking financially. I'm talking childcare. I'm talking lactational. I'm talking postpartum support. You have to be able to come to the table with resources from a place of humility and say, thank you so much for your lived experience and expertise. I'd love for us to think about ways we can partner together.
And that they continue holding space for feedback to continue improving systems of care.
As we're learning from our families, we're also teaching them the people to policy pipeline. So we want the people to know what policies are actually influencing the resources that they have access to, and how can we also implement change in real time. And that's where the feedback loop comes from.
There needs to be money for the evaluation, and the evaluation includes people from the community, and that there is a built-in feedback loop for updating policy, addressing the issues that come up as we go along.
Governor Murphy made a surprise appearance, telling the crowd it's taken 70 pieces of legislation to get to where we are now. There's no telling how many more bills will need to be signed to continue moving New Jersey toward even better maternal health outcomes. For NJ Spotlight News, I'm Joanna Gagos.
Support for the medical report is provided by Horizon Blue Cross Blue Shield of New Jersey, an independent licensee of the Blue Cross Blue Shield Association.